Welcome back to my channel, everyone. Now, if you do suffer from BPD, you will know that dissociation is a common symptom. And while I already discussed what dissociation is, I figured that today I would draw specific attention to depersonalization and derealization. And so in today's video, we will be talking about those two different forms of dissociation, what the causes are, what the symptoms are, and what to do about it. Now, when it comes to depersonalization, derealization disorder, this is a disorder in which we can see that breakdown awareness in two core things, that being ourselves and our environment. Now, this is different from psychosis because while we are dissociating, we are aware that the detachment is not reality. And I'm sure that even if you don't have BPD, most of you can understand to a certain extent depersonalization, derealization. Now, this is a common experience, and I would say that about 50% of people have already experienced mild dissociation. So remember a time that maybe you were driving home or doing something and you completely zoned out, and next thing you know, you arrived at your destination without really knowing how you got there. This is a mild form of dissociation. The difference, though, is that this usually lasts seconds or maybe minutes, but with someone who has depersonalization derealization disorder, or DPDR, this can last hours, days, months, and even years. Okay, so what is the main difference between depersonalization and derealization? Depersonalization, as you may have guessed it from the name of it, refers to a person, meaning yourself. And it's the sensation of being really disconnected from yourself. It may seem as though your speech or your movements are distorted, slowed down, like you're outside of your body and you're experiencing yourself from a different perspective. It may even feel like you're not in control of your movements, of sensations that you're experiencing. Derealization, on the other hand, is the relationship that we have to others and our environment, meaning that similarly to depersonalization, we may feel distant from our environment, from others. We may not recognize people per se. Things may look distorted or seem different. You might have objects that look smaller or a different color than the actual shape that they are. And we may experience this feeling of complete disconnect from our environment. And so just to sum it up, depersonalization, it really has to do with yourself, feeling disconnected from yourself, like your speech, your movements are not coming from you. You might feel very numb. And derealization, it's in relation to others in our environment, so we feel disconnected from those things. Things may seem distorted in the environment, the closeness of objects, the shape, the size, the colors of things. Things might seem slower or faster than they actually are in real time. So what can cause DPDR? So there's obvious things like taking psychedelic drugs or hallucinogens that will obviously distort your perception of space and time. Time may be really slow, colors are different, objects may actually move or distort themselves according to your vision. So that's one thing. We can also see this in sleep deprivation, for example. When we're really sleep deprived, our speech may sound weird to us. We may not really recognize our body, or movements may seem slowed down. And so those are things that can happen to us that may cause some form of dissociation. And once again, like I was saying, for those of you who don't have BPD, maybe you can relate to those, okay? The main thing, though, in terms of DPDR would be childhood trauma. When you're a child and you're experiencing trauma in the moment, you don't necessarily have the tools to know what to do with the abuse that you're being subjugated to, or whatever is happening to you in the moment. It can be really hard to reconcile, for example, if we have a parent that's an alcoholic, and during the day, they're the best parent in the world. And at night, when they come home from the bar, it's at that moment that they seem like a different person who's very abusive in whatever way that you can imagine. It might be hard for us to think, well, why in this moment is this person so loving and caring, and then the next, they're extremely abusive and hurtful. We might dissociate in those moments, not knowing what to do. And so dissociation is an adaptive way of dealing with trauma and protecting your own psyche from abuse or intense things that you may have lived. The problem is that this carries out typically into adulthood, and at that moment, it's not so much adaptive because you might dissociate for minor triggers that have to do with the big one, but is impairing you from developing relationships with others, from really engaging in your environment and your work, because you're always numbing out, you're dissociating, you're missing bits of information, or you're forgetting parts of the day because you're being taken out of your body. So if you think that you suffer from DPDR, what do you do? First thing I would recommend is really to lean into therapy. Therapy can look like many different things. It can look like regular talk therapy, where you have someone help guide you in unraveling past trauma. It can look like movement therapy, where you're using physical movement to kind of unlock these traumas that have been trapped in your body and maybe places that you're not aware of. And so it's really finding a good modality that fits well with your needs, and also a good therapist that you can develop a strong therapeutic alliance with. That is the main thing, to have an environment in which you feel secure. So that would really be number one, the first thing that I would recommend. Second thing would be using grounding techniques. Because with dissociation, oftentimes we can recognize that we're doing it, we can implement some grounding techniques. So you can use your 5 senses. So naming one thing that you can touch, one thing that you can smell, taste, see, and hear, and moving through that cycles as many times as you need. You can also use the ABCs, so looking around in the room and naming one thing that starts with an A, and then a B, and C, D, E, and you go through the whole alphabet. Once again, repeating that as many times as you need, using DBT tip skills like using ice or cold showers, something to really ground yourself, anchor yourself back into the present moment. Lastly, and of course always discussing this with your healthcare provider, would be the possibility of taking medication. So medication with anxiety or depression can be useful tools to help with dissociation, to help you feel more grounded and anchored in the present moment, so that therapy might be more effective. The important thing to take away from this video is to remind yourself that at some point, dissociation was useful and adaptive for you. You didn't do anything wrong. This is not your fault. This is your way of your mind and your body trying to protect you. On that note, thank you for taking the time to be here with me today. I wish you all the best week, and I will see you next time for another episode of On the Line.